Good morning. Welcome to the Wednesday, June 3rd, 2026. I have a roll call.
Yes, Vice Chair. Thank you. Commissioner Jim Anderson,
Present.
Commissioner Roger Anderson, Vice Chair Joe Clark,
Here.
Commissioner Justin Cummings,
Here.
Commissioner Fred Keeley,
Here.
Commissioner Manu Koenig,
Here.
Chair Rochelle Lather, Alternate Commissioner Kimberly DeSerpa, Alternate Commissioner Lonnie Faulkner,
Present.
Alternate Commissioner John Hunt,
Here.
Alternate Commissioner Eduardo Montesino.
Here.
Vice Chair, we have quorum.
Thank you.
And Vice Chair Clark, I'll just note that since Chair Lather and Commissioner Roger Anderson are not here, so Commissioner Faulkner and Commissioner Hunt will be voting members.
Thank you. Are you looking for comments on the hybrid meeting?
Thank you, Vice Chair. So just a quick update for the audience. We are conducting this meeting under a hybrid model. So members of the public have the option to join this meeting virtually or in person. And I do want to welcome the commission and the public to the Scotts Valley Chambers. I'm hoping that we are back in the county building in August, but we'll see how that goes. But for now, we're here in Scotts Valley. Members of the public do have an opportunity to address the commission on any agenda item. You'll have up to 3 minutes. We'll let you know when you have 1 minute left and when your time is up. For those joining us in person, the podium right behind you is where you'll speak. For those joining us virtually, you can click on the reactions tab and you can raise your hand there. For anyone joining via conference call, if you press *9, that'll be able to raise your hand. Vice Chair, we do have a commissioner joining us remotely. So under state law, we will require a roll call vote for any item that requires commission action. That concludes the overview of the hybrid model. I do have another update, and that's in regards to the recent event that LAFCO hosted for the local agencies in our county in regards to SB 827, which requires financial training and other kind of administrative oversight on how to be an effective local agency. So that was well received. We have over 50 people joining that free event that LAFCO co-hosted with CSDA. Our chair was there as well. And what I've heard, it was a lot of positive feedback from the local agencies. Again, this helps them fulfill that statutory requirement. And it's just another way that LAFCO is just beyond a boundary agency. We're here to be a resource to the local agencies. And that was just one example of how we can accomplish that. Vice Chair, that concludes my updates. I'd be happy to answer any questions.
Questions? No questions. I'll go to the public. Any public questions about today's meeting? None. Commissioners? Thank you. Bring us to number 3, adoption of minutes.
I'll move adoption of the minutes.
I'll second that. I get a roll call?
Thank you, Chair. Commissioner Jim Anderson,
Aye.
Vice Chair Joe Clark,
Aye.
Commissioner Justin Cummings,
Aye.
Commissioner Fred Keeley, Commissioner Manu Koenig,
Aye.
Alternate Commissioner Lonnie Faulkner,
Aye.
and Alternate Commissioner John Hunt.
Aye.
It passes.
Bring us to item 4, oral communications. Time that the public make comments on anything that's not on today's agenda.
So we do have one request online. I just want to remind members of the public that this is comments for items that are not on today's agenda. So I'm going to ask Timothy and Fulton to speak.
Hi, can you hear me?
Yes, sir.
Yeah, I just wanted to thank LAFCO for your various reports and communications that have brought our community's attention to the changing needs of the Felton Fire Department and focusing on the fact that the volunteer model wasn't working so well. And we've gathered as a community and tried to move forward towards the NFPA standards and recognizing the unique situation, both geographically and demographically, that we have here in Felton. We've been working towards a reorganization that can meet the community's needs through an assessment, through a benefit assessment. And while we recognize the overall direction of perhaps consolidating districts, we feel that Felton's future is best served in the short term by putting together the community support and financing to create a healthy and vital fire department here that can provide timely and effective services in both emergency medical and fire situations that the community has become accustomed to under the leadership of its current interim chief. So I want to thank LAFCO for their direction in these matters, and I want to just note that the community has responded very actively and very positively to try to achieve those ends. So thank you very much.
Thank you, sir.
Thank you. Looks like we have a speaker. Welcome.
Good morning. My name is Becky Steinbruner. I'm a resident of the Santa Cruz Mountains in the Aptos Hills. I want to also thank LAFCO for your good work. And I want to ask, I think that I am not allowed to comment at the end on correspondence, so I will do so now regarding the, and can you clarify that? I'm not allowed to comment on correspondence.
So later in the agenda, there is written correspondence, and that would be an opportunity for the public to address the commission on that item. So you do have an opportunity
Okay.
to speak on that item.
All right, thank you for that clarification. I'll wait on that item. But I do want to also review what your commission talked about at the end of your last meeting, and that was regarding the battery energy storage system, or BESS ordinance, and the project in permit review now under the state California Energy Commission, the project, the Seahawk Energy Project at 90 Minto Road. I took great interest in Director Serrano's comment that LAFCO is watching it carefully and that project would have to come before your commission as an extraterritorial water service with the city of Watsonville. So that project now is, as I said, under the state AB 205 opt-in certification review process. The docket, the comment docket, is open. You can go to that directly from the CEC, California Energy Commission's website, or there's now a link to that on the Santa Cruz County BESS Ordinance webpage. So I encourage you to keep on top of this. It does not mean that we have no say, and I want to make that clear. It does not mean that we have no say in this project. In fact, it's quite the opposite. We have more say because the county was not allowing robust public comment or even meetings about it. And so now we have that chance to be at the table with the state. The state is going to be soon, once the application is deemed complete, opening up CEQA process with a meeting in the area. And I encourage you all to participate in that and keep an eye on this. In closing, I just want to say that I often urge the LAFCO to review water service agreements with the same zeal for consolidation as what we are seeing with the fire districts. Our water is regionally managed, and I think that this also bears merit to have consolidated to some degree, consolidation among the large municipal water districts in our area. Thank you.
Thank you.
Vice Chair, there's no other requests at this time.
Thank you. I'll bring it back to any commission comments. Seeing none, we'll bring it item 5, special presentations. Oro Valley Healthcare District update.
Thank you, Vice Chair. I'll introduce the CEO of the Healthcare District, Mr. Steve Gray. We've been following the Healthcare District since its inception, even prior to it being formed under special legislation. And there has been some, it's no shocker here. The Healthcare District has been in the news over the past year on their sustainability. And at your last meeting or so, there was a lot of questions about the Healthcare District when we provided you a status update. And so we wanted to bring a representative from the Healthcare District to answer questions to the commission, but also hear what's currently on the horizon, what are their current challenges, and how they're going to be addressing that. So without further ado, I'll refer to Mr. Gray to provide us an update on how the Healthcare District is doing.
All right, Mr. Serrano, thanks very much for that introduction, Commission. Thank you for having me. I didn't bring any slides. I didn't even bring any notes. I just want to give you a brief verbal update, and then I'm happy to just sort of have a dialogue about what your questions are, what your thoughts are on where we're at and what we're working on. So I feel that the healthcare district, so my name is Steve Gray. I'm the CEO of the Pajaro Valley Healthcare District and our hospital, Watsonville Community Hospital. One of the pieces of news lately, I'll just get it out of the way so that we can, because it's not really, this presentation is not about me, but I will be leaving my post in mid-July. And that's a personal decision. And what I've done is I've worked really closely with my board to, over the last few weeks, to start the process of that transition and what that looks like. And so I'm really committed to making sure that that's a smooth transition. And so I'm really confident in our board to be able to do that, and my working with them to do that. And I feel like this is a really time for a healthy and positive transition for our healthcare district. And I'm going to give you 3 of the kind of whys around that. The first one is the other item that was in the news recently, which is that our hospital was just awarded a large grant from the state of California. Really want to thank publicly again Senator John Laird for all of his amazing work on that. He helped bring Assembly Bill 108, which was a $25 million grant program for hospitals in the state of California. He brought that to the Senate Budget Committee and got peppered with questions about it. And other Senate members of the Budget Committee were concerned, and what about our hospital? What about, we need more? And he still got it passed 18-0 out of that commission, and the governor signed it later that day. And so Senator Laird is continues to be an amazing advocate for us. So that was a $25 million grant. 11 hospitals in the state applied for it. 4 received money from it, and we received 10.6 of the $25 million. Which is a wonderful grant for our hospital. It's different from the one that we got in 2023, which was a loan. This one is a grant program. One of the stipulations of the grant program is that we can't close services during the time that we're using those dollars. So that's a good thing for our community. It's not something that our board was contemplating anyways, but it's something that gives us more opportunity to strengthen the services that we have. The reason that grant was needed is because of federal delays. So we have, as you know, we take care of a lot of patients who are insured by government insurance, either Medicare or Medi-Cal. About 85% of our patients have either Medicare or Medi-Cal. Close to half of our patients have Medi-Cal. As you know, the HR 1 that was signed in July 4th of last year had significant cuts, about $1 trillion to Medicaid or Medi-Cal here in California. And another item that bill did was it delayed and changed some of the rules around some of the hospital programs that help provide additional backfill funding for taking care of Medi-Cal patients. So when a hospital in California takes care of a Medi-Cal patient and it costs the hospital $100 to take care of that Medi-Cal patient, we might get reimbursed $30. Depends on the type of service, but we've got to make that up in other ways. One of the ways that we make up for some of that is something called the hospital fee program. The hospital fee program, every state has one. In California's, every hospital in the state pays into it. The state then gets matching dollars from CMS at the federal level, and then the state redistributes those dollars back out to the hospitals based on how many Medi-Cal patients they take care of. So since we take care of a large portion of Medi-Cal patients, we put a little bit into the program and we get quite a bit back. So those programs are numbered sequentially, 1, 2, 3, 4. We've been in program 8 the last couple of years. Program 8 netted us about $17 million from that program. Program 9 was supposed to have been approved last summer. It didn't get approved because the new bill came into play and because the CMS then told the state, resubmit, reapply, all of this stuff. So they've been going back and forth between the state and CMS for a year now. So 16, 17, $18 million that would have come to our hospital over the last 11 months has not yet come to us. And so that's a big reason why that bill was put in place in the state to help hospitals like ours backfill that cash that really is owed to us, but we've had to absorb on our own. The way we've absorbed that is essentially through some debt, so that we have fully encumbered our line of credit. We have increased our accounts payable balances to vendors, so we have vendors who we owe money to, and that's where the need for that $10.6 million grant comes in. And so we're really appreciative to be able to have that and give us some room to be able to continue to work and do the great work that the team is doing. So I can talk more about that in a minute. The other two items for the reason for the good transition, one is that, as many folks know, we've been looking for a strategic partner. So going forward into the world of HR1 Medi-Cal cuts, we know that 27% of people in our community are going to lose Medi-Cal and become uninsured. These are Central California Alliance for Health has done these estimates, and so we've looked at what that means to our hospital specifically. It's a $5 to $10 million annual loss for our hospital as a result of just that piece, going forward over the next 3 to 5 years. And so we've been really looking hard as a strategic imperative for a strategic partner, a large organization, nonprofit organization, local organization that can come in and help partner with us to recruit more physicians, to keep more patients in our hospital and in our healthcare district, in our clinics, and be able to care for more people in our community. That strategic partnership process, we're moving forward really well with one potential partner. That ended up not happening, and so we're kind of in between those conversations. I've got another conversation lined up later today with a different potential strategic partner. And so we've got this sort of in between phases with our strategic partnership search right now. And so that's another good reason for sort of where we're at and with the opportunity for a strong, healthy transition right now. And the third one is our strategic planning process. So when the healthcare district was formed in 2022, 2023, the district put together a 5-year strategic plan. And so we have accomplished much of what was in that strategic plan. And I'm really proud of the team for all that's been accomplished. One was Measure N. So that was our bond measure, general obligation bond measure, which raised $116 million over the next number of years. We used the first $40 million almost immediately by buying the property back. So the healthcare district now is the owner of the Watsonville Community Hospital property. And we've used an additional 10 or 12 by the end of this year for new and improved services, and also some really important infrastructure upgrades that the previous for-profit owners over the last 30 years had just deferred for us. So we're able to use the first tranche of bond dollars for those things, and then we'll have additional tranches that will come forward over the next few years for additional service upgrades, additional service expansions, capacity expansions, and more of that deferred maintenance that we have on the plant and the property. Part of the other parts of the strategic plan that we've been able to accomplish have been bringing primary care to our healthcare clinic. So our district doesn't just run the hospital, but we also have Coastal Healthcare, which is our district clinic, and we have about a dozen physicians in that clinic. Historically, it's been mostly specialists, so surgeons and medical subspecialists. We've brought on 2 primary care physicians in the last year, and folks can correct me if I'm wrong, but if I look around the community, they're among, if not the only primary care physicians that have open capacity and are open to accepting new Medicare patients. Most places have kind of shut down to Medicare enrollment unless you're on a Medicare Advantage plan that sort of assigns you to one of those doctors. But for traditional Medicare, there's most doctors have kind of closed their doors to that in California because it's so challenging financially for physicians. So we've been able to start primary care, grow that clinic, and at the hospital, the team has done some amazing things despite all the financial challenges. And I'm gonna end on these notes. One is that our patient experience scores at Watsonville Community Hospital, when the district took over, we're in the bottom third of all hospitals in the country. They're now in the top third of all hospitals in the country. So the ratings that patients are giving to on their patient surveys, that every hospital does the exact same survey across the country because CMS requires it. And so you get to sort of look at all those compared to every other hospital. We've made some really statistically significant improvements in that. And then the other one is our hospital safety grade. So Leapfrog Group is a nonprofit group that takes publicly reported data and also takes self-reported data from all hospitals around the country and gives a letter grade A through F on how safe your hospital is and how the patients rate your hospital. And we were a D when the healthcare district took over, and we quickly moved up to a C and then spent about 1.5 years at a B. And in the spring of this year, we received our first A. And so that is a really huge accomplishment. I've worked in a number of different systems that had a lot of financial resources, and that's really hard to do. Both of those things are really hard to do regardless of your resources. And so for this clinical team to do those 2 things, improve patient satisfaction so much and improve a safety grade from a D to an A, is all pretty amazing, and really proud of the doctors and the nurses and the staff and the leaders at the hospital for being able to accomplish all that. So that's where we're at right now. I'll finalize with one thing, which is the financial picture currently. And that is, last year, as you know, we ran into a number of headwinds, and headwinds is probably a light term for what we ran into. We had a major cyber attack. We had the big beautiful bill that was signed, and we had significant avoidance of healthcare as a result of immigration fears in our community. So we saw, you would think that people would go to the emergency department whether they needed it or not, but we actually saw for a few weeks in the summer last year where the emergency department volumes went down by 30% because there was feared ICE activity in the community. And so people were really avoiding care for quite a while last year. So for a while last year, we were losing $2 million a month at the hospital. This year, through the first 4 months, we have a positive operating income. So we have about a $700,000 positive operating income for January through April of this year. So a great turnaround. We feel like we've got the handle on managing our expenses really well, on bringing in the revenue at the right rate that we need to, getting word out to local physicians about bringing their patients to us. How do they refer their patients to us? The new services that we've brought online, things like that. And so that's another, I think, sort of the final reason for we're in a spot for sort of a good next chapter for our hospital and our healthcare district. With that, I'll stop talking and take a sip of water and answer any questions you have.
Thank you, Mr. Gray. And more importantly, thank you for your years of service. Appreciate it.
Yeah, thank you.
I'll open the floor up for public comment.
Thank you. My name is Becky Steinbrunner, and I wanted to attest to the good quality of care at Watsonville Community Hospital. My husband and I spent recently hours in the ER, and it was tremendously positive. And I want to thank you. They helped us get him to Stanford, where he really needed to be. and continues to be. So our doctor, our personal doctor, has always recommended that we go to Watsonville Community Hospital. We live in Aptos, so we could go either way. But our primary doctor has always recommended Watsonville Hospital, mostly because it has the lowest incident of MRSA, drug-resistant staph infections. That speaks well of your staff, your procedures, and we have always had excellent care there. So you brought up Measure N, and I want the commission to really listen to this because Second District Supervisor Kimberly DeSerpa made it publicly known that the Measure N assessments are all messed up. And if you go to the Santa Cruz County Assessor's website, you will see how the county has had to correct that mistake. It is a big mistake. Over 19,000 parcels were not billed, were not assessed for the Measure N monies to support the hospital. And another large number, and I don't remember, it might be 4,000 or 5,000, were over assessed. So the county assessor is correcting that information, but what I want your commission to look at is the possibility of expanding the Pajaro Valley Healthcare District boundaries. I think it needs to be expanded. I'm not paying, but I would like to pay because at the time, my feeling was that those boundaries were hastily drawn because of the emergency imminent closure of the facility, and Senator Laird was really pulling things together. And the boundaries were too hastily drawn. I think those need to be reconsidered and expanded, quite frankly, because of the service and the need and the geographical area that really the Watsonville Community Hospital does serve. I also want to know that Kaiser seems like it could be a very good partner. I know that Kaiser had intended to build a huge facility on Soquel Avenue Frontage Road, and that didn't happen. And I understand there are some services at Watsonville, but that seems like a good partnership. Thank you. Thank you for your work.
Thank you. Any other speakers? Staff, do we have anybody online?
No one online, but we do have Commissioner Montesino that wants to speak once you open up for commission deliberation.
Great, thank you. I will now open it up for commissioners' discussion and questions.
Commissioner Montesino, if you want to provide your comments or ask your question.
Yeah, Dr. Gray, really positive comments, but as a concerned resident here in the city of Watsonville, do you think you're going to be able to get a partner like Kaiser or Sutter to partner up with you? Because the path, it's rocky. Healthcare is a difficult business, and the federal government is not making it easier. And and people are concerned about going to any they don't view you as a government agency, but they view you like especially with a nice potential ICE facility coming on board in Gilroy. There's going to be more fears, and people are not going to be at the emergency room trying to get services. So just some thoughts.
Yeah, thank you, Commissioner Montesino. I appreciate that. We do still feel optimistic that we can find a strategic partner. We also feel optimistic that we can keep figuring it out on our own if we have to. And that's really, the board is, feels really strongly in both directions. We feel like we've got some really positive attributes that make us a good partner for a larger healthcare system. And there's a lot of different ways that could look. Like that could look like, a partner coming in and, leasing and running the hospital, or it could be something more of a management services agreement where we're partnering for They're helping us with our supply chain and our purchasing, so we're benefiting from the better pricing that they can get. We're benefiting from economies of scale and backup, right? We as a small independent hospital, most of our support departments are like 1 or 2 or 3 people. And so when 1 or 2 people of that department, are sick or on medical leave or leave, you've kind of you don't have much and you've got to then figure it out. And there's a lot of positivity to potentially having a partner that has that backup and making sure that those systems are in place. That is really hard to have when you're on your own. And we've been on our own for a while and been figuring it out. So if that's the path that it needs to be, we'll continue to work that path and continue to figure that out. And as I said, we've got some positive things going on our own, like the remaining Measure N dollars. If I could, I'd like to respond to one of Ms. Steinbrenner's comments, and thank you for your positive feedback on the hospital. And I hope your husband's okay. And if there's anything you need, please let me know. On the assessments, the county assessor did come to one of our board meetings and speak to that and apologize on behalf of the county, which was nice. I think the numbers that you had are just a little off, so I just wanted to correct the commissioner. I think there were 19,000 that were assessed and there were 3,000 or 4,000 that were missed. And as a result of the 3,000 or 4,000 parcels that were missed, the 19,000 remaining got overassessed. So they've corrected that on the next set of bills. So the 3,000 to 4,000 that got missed are getting their bill now, and the 19,000 that got overassessed are getting a smaller bill next time to correct it going forward. So they've identified that issue in their system, and they're working on correcting it. And the question of our sphere of influence and our boundaries is a great one, and something that our board has definitely been looking at as well. Yeah.
Thank you. Start Commissioners' questions on this side.
Thank you. I think you answered one part of my question, which is what are you looking for in a strategic partner? And it sounds like you're open to a variety of things there. But the other part of my question would be is what would they be looking for in the Watsonville Hospital from your end as a strategic partner? And where might that gap be needed support?
Yeah, thanks for that. The what a partner could be looking for in us will also range as well, depending on what their business situation is. So every hospital around us knows how important it is that we stay open, because they are at capacity in their emergency departments. If you've ever gone to any of the other emergency departments around, you know how long you have to wait, how many people are there, how many people are waiting for a bed, those sorts of things. And county EMS has done a study on what would it look like if our emergency department were not there. And it's pretty tragic, right? If you're going to Dominican or to Natividad, you're going to have to wait significantly longer. They're already full. They're already overburdened. They couldn't handle the additional volumes. And for the people who live near Watsonville Hospital, the additional wait time for an ambulance and the additional drive time to get to the emergency department is going to mean, lost tissue and lost lives in the case of heart attacks and strokes and things like that. And so it's pretty devastating. And so there could very well be hospitals or healthcare systems that are near us that want to partner to the extent that they can at least keep us whole, right? Maybe not to the extent that they want to, that they feel like they want and need to have the hospital, sort of do new things for them, but to make sure that that the healthcare ecosystem is sustainable. And we have a lot of, we have inpatient capacity. We have a couple of inpatient units that have just been closed for years because of funding and staffing, and those could be opened back up. Whether that's, one of the systems that we currently partner with or a new system that we haven't partnered with yet before, some of those units could become long-term acute care facilities. They could become acute rehab facilities. There's all sorts of things that we could do. And what we need from that kind of a partnership would be the physicians, right? So recruiting physicians to this area, really difficult, really expensive. And that would be a big benefit of having a partnership, would be to recruit more physicians, keep more patients being cared for in their community.
I'd like to ask Director Serrano if you could remind us of the steps that would be necessary to change the boundaries of the district. Would that be initiated by the district itself? And what uh, barriers or obstacles would be involved and what the timeline?
It's a good question. So there's two boundaries that LAFCO plays a role in. If we're talking about the sphere of influence, which is a planning tool, that can be initiated by this commission, or it can be initiated by the affected agency. That's doesn't require any statutory steps other than us having a discussion determining why does the sphere need to be amended. Now, if we're talking about its jurisdictional boundary, that does require some legal hoops that we need to go through. For example, it needs to be initiated by the affected agency or the county or the landowners to change the boundaries of the district. So right now, it's pretty much South County. It does go into northern Monterey County. So to answer your question on the steps, we would need an application. And that application needs to have a initiating document. For example, the district could hypothetically adopt a resolution saying we want to annex the remaining portion of Santa Cruz County into our jurisdiction. That application will then be processed by your staff within 30 days. I will indicate to the applicant if there's anything missing. 99% of the time there always is something missing. Then I'd coordinate with the county because that will require a property tax exchange agreement, a plan for service document. We also need to educate the residents of why this is being proposed and if there's any financial impacts to those residents. So you are seeing a multi-year effort, depending on the size of the annexation. But LAFCO would have to consider it if the application is deemed complete. And then this commission will have the discretion of either approving, denying it, or modifying that application. So that is something where that's one of the crux of the LAFCO process is amending jurisdictional boundaries when we deem it necessary and beneficial to the residents.
Further questions?
Thank you, Chair. Thank you for the presentation. I just had a couple clarifying questions and to start with, I know you said 27% of the people who, well, 27% of the people who go to the hospital are anticipated to lose their health coverage. I was wondering what's that in numbers?
Yeah, so that is an estimate from the Alliance. So they've done an estimates across their 5 counties that they serve. And the counties are pretty similar in terms of loss, and it's 27% of people currently on Medi-Cal who will lose their Medi-Cal over the next few years due to the various new requirements. You have to re-register every 6 months, and there's going to be a work requirement starting next year. In terms of numbers in the county of Santa Cruz, I think we have 80 to 90,000 total in Medi-Cal, and so that would 27% of that would be a little over a quarter of that. So 20,000 or so people will be losing their Medi-Cal.
Got it. Speaking about the cyber attack, I'm just wondering maybe if you could kind of speak to some lessons learned around that, because I'm wondering, I mean, it sounds like or at least my understanding is that the hospital kind of just ended up paying out that cyber attack to resolve that issue, or maybe you could speak a little bit more to how that was resolved, and just wondering if there's opportunities for the insurance or for the state to kind of help us shore up those losses rather than just falling on the healthcare district.
Right. Great. So so thank you for that. So the cyber attack was it was the day after Thanksgiving in 2024. I was home watching a movie with my family, and I got the call, and then I didn't come home again for a while. What happened was it was an outside actor out of the country who got into our system, and what they got into was a shared file server. So like as an individual might have a folder on the network where you would just sort of drag and drop files. They didn't get into our electronic health record. They didn't get into our employee record, database, anything like that. Those are all housed elsewhere. And so our internal cybersecurity team recognized it, shut it down, and basically shut everything off. and had backups of everything. So was able to restore everything. Didn't matter whether or not the threat actor encrypted stuff or not. We were able to bring it all back because we had backups of everything. So I'm actually not going to get into, whether anything was paid or anything like that. But we do have and still have cybersecurity insurance. And so that pretty immediately started paying bills for us because we had cybersecurity kind of cleanup crews, if you will, right? That these external firms that help you do the investigation and help you identify what happened, help you install things like CrowdStrike on every single computer, which we didn't have. We had a lot of things, but we didn't have kind of the latest, greatest state-of-the-art things. So we have those now on every single device. And so some additional security measures that have been put in place to make sure that it doesn't happen again. But cyber insurance was able to start paying those bills for us on those new expenses. And then earlier this year, we finally got a reimbursement from our cyber insurance for the lost revenue during the time that the outage happened, because we were essentially on paper records like the old days for almost 2 weeks. And so that we had to cancel some surgeries and cancel some cases and things like that. And we got a revenue reimbursement from cyber insurance just in March of this year.
That was helpful. I was just wondering, because you mentioned there were some losses due to the cyber attack, and I was just kind of wondering.
Yeah, the main losses, the main losses were, it was cash, right? So if you think about your household and you're living paycheck to paycheck, because we had 8 days of cash on hand when the district took over the hospital. And so then you go 2, 3, 4 weeks without being able to take more money in. Normally you would rely on your cash reserves. Well, we didn't really have any. So we relied on pulling on our debt strings to get us through those times and make sure that we could keep making payroll every week. So that's where the impact came. It came on the cash side. Yeah.
Further questions? Seeing no further questions. Thank you, Mr. Gray.
Thank you for having me.
Your service.
Appreciate it. Thanks for having me.
No item is requested on this matter, so we will move on to number 5, public hearing. Boulder Creek Fire Protection District Station Partial Annexation.
Thank you, Chair. I'll keep this presentation brief. This application involves 2 parcels being annexed into County Service Area 7, which is managed by the county and provides sewer service to residents. The full analysis is attached to your agenda packet today. For today's presentation, I'm just going to hit the key factors of this application. First off, this is a result to a condition that we included in the 2024 Extraterritorial Service Agreement that we approved, allowing the county to provide services to the fire district's fire station as we consider the annexation, because annexations typically take 6 to 8 months to complete, and it's a straightforward, simple single parcel parcel. But the ESA is a temporary assistance, so it's a stepping stone to annexation, and that takes about a month or 2 to complete. So this allowed the fire station to receive services from the county immediately. But we had a condition in that resolution that this annexation should occur within the next 2 years. This fulfills that condition. I will mention that the county, which manages CSA 7, has indicated that they're willing and capable of providing services to this fire station and the subsequent parcel. And just a reminder, the county is the applicant of this annexation. Based on staff's analysis, this fulfills the statutory requirements, and it also is consistent with our local policies. But it also reflects this ongoing effort to help the Big Basin water community as they look to transition to a more sustainable infrastructure. As part of the court receivership that took over this private water system, they realized that they also provide sewer services to a small population. So that transfer was through a collaborative effort, and I give kudos to the county for taking on that additional responsibility through CSA 7. But we realized that these two parcels are outside CSA 7, so it requires this annexation. So this, again, reflects the ongoing efforts to help the residents in the community. And Boulder Creek Fire is a constituent of CSA 7 under this annexation. So therefore, staff is recommending that the commission approve this annexation by adopting the draft resolution. And Vice Chair, that concludes my presentation. I'd be happy to answer any questions.
Thank you. At this time, I'll open it up for public comment.
Vice Chair, we do have a request, and this is from Chief Bingham, who with Boulder Creek Fire. So I'm going to ask the chief to unmute himself.
Thank you.
Yes, good morning. I just wanted to say thank you for that briefing. Mr. Strano was succinct and correct. It needs to be noted that there is still an ongoing issue with Big Basin water and the sewer system included. And we appreciate the board paying attention and taking care of that, especially overseeing the receivership. I also wanted to make a note that the station, however, the land and the fire station is owned by Boulder Creek Fire Protection District. There still is an operating lease with CAL FIRE that has an engine in there operating every day, 24/7. And this would benefit both agencies as we are partners. And so I just hope that the board will approve us moving forward. Also, to make a note, we have historically always been on the Big Basin Water and Big Basin Water sewer service out of that fire station since, I believe, 1980 or 1979. Thank you.
Thank you, Chief.
Any further public comment? Seeing none, bring it back to commissioners for questions for staff.
I'll move approval of it since it's a condition that we made on it some time ago and they're complying.
May I get a roll call, please?
Thank you, Vice Chair. Commissioner Jim Anderson,
Aye.
Vice Chair Joe Clark,
Aye.
Commissioner Justin Cummings,
Aye.
Commissioner Fred Keeley, Commissioner Manu Koenig, Alternate Commissioner Lonnie Faulkner, Alternate Commissioner John Hunt.
Aye.
Motion passes.
Thank you. Item B, Lequester Road / Hyde Stephan External Services Agreement.
Thank you, Vice Chair. I'm going to toss it to our analyst, who was the project manager for this application.
Thank you, Mr. Executive Officer, Mr. Vice Chair, Commissioners. Good morning. This will be quick as well. The report and the application process for this proposed extraterritorial service agreement is detailed in your agenda packet. But for the purposes of this presentation, I'm highlighting the key points. Number one, in March, we received an application from a landowner requesting sewer service for 2 parcels from a public agency, in this case, the city of Scotts Valley, in accordance with Government Code Section 56133. Through this process, the landowner will be able to discontinue use of their septic tank and receive sewer services from a nearby public entity. Again, we have 100% landowner consent, and we will be moving forward with the request. And number two, the city of Scotts Valley has indicated that it is willing and capable of providing the requested services. The request was actually considered and approved by the Scotts Valley City Council on March 4th, 2026. Next, the request is consistent with state law and the commission's adopted policies. The subject parcels are within the city's sphere boundary. Staff has determined that the city of Scotts Valley is the most logical provider for the requested services. And they're already providing sewer services to a nearby parcel through another ESA. And finally, staff has reviewed the application. The request makes sense. It's consistent with our policy, state law. The city has indicated that it can provide the requested services. Legal counsel has reviewed it. And now we are recommending adopting the draft resolution approving the extraterritorial service agreement involving the city of Scotts Valley. Mr. Vice Chair, that concludes my presentation, and I'm happy to answer any questions the commission may have.
Thank you for the presentation. I'll now open the floor for public comment. Seeing no public comment. Anybody online? No?
No, sir.
I'll now bring it to commissioners for questions to staff. Please.
You mentioned that they can abandon it. Is that going to be a requirement of this approval as to that they do abandon the septic system?
Yes, Commissioner. The request was to move away.
Okay, thank you.
Further questions?
Just a quick question on page 51, I believe it says LAFCO typically encourages boundary changes. Annexations. Will there be a future annexation sought after? I know it's
So
time,
in-
so given the current situation, they timely fashion annexation would be.
Good question. And yes, so since 2019, this commission, when the board has considered ESAs, we have in place a condition in the resolutions indicating that annexation should occur. It depends on the request. So yes, there is a condition in the draft resolution that encourages the city to consider annexation in the foreseeable future. That's something that we are coordinating with the city as we speak, because they have a number of ESAs. And I think it's timely for us to have that conversation and start annexing these ESAs. So yes, we are encouraging the city, and there is a condition in the draft resolution in regards to annexation.
Thank you.
And if I could add, we did the municipal service review for the city of Scotts Valley last month, and we did ask them to please consider their 13, and this will be the 14th ESA, and what they would like to do moving forward.
Thank you. Also on page 58, I think there's a typo, an O instead of a D under indemnification.
Thank you, Commissioner. I will make note and we will make corrections.
Other questions? Please.
I'll move the recommended actions.
Second.
I get a roll call, please.
Yes. Thank you, Vice Chair. Commissioner Jim Anderson,
Aye.
Vice Chair Joe Clark,
Aye.
Commissioner Justin Cummings,
Aye.
Commissioner Fred Keeley, Commissioner Manu Koenig, Alternate Commissioner Lonnie Faulkner,
Aye.
Alternate Commissioner John Hunt. Motion passes. Mr. Executive Officer.
Thank you. Bring us to item C, countywide fire protection service and sphere review.
Thank you, Vice Chair, and I really appreciate everyone's patience. I believe you're here for this item. So I'll try to keep my presentation as brief as possible, but there is a lot to cover, so I'll do my best. As this commission knows, there are 12 fire agencies in the county that are tasked to provide an essential service, fire protection and emergency medical services throughout Santa Cruz County. That includes 8 independent fire districts, 2 city fire departments from Watsonville and Santa Cruz, and also 2 county service areas. So county service areas are dependent special districts. So rather than having their own staff and their own board, they are managed by another local agency. In this case, CSA 4 and CSA 48 are managed by the county. Now, again, this is another robust report that analyzes those 12 agencies. For purposes of today's presentation, I'm just going to give you the key summaries of that report. The first is that this report is a comprehensive analysis of the 12 agencies, but we didn't want to replicate what we did 5 years ago. So back in 2021, we did a deep dive analysis of the 12, well, at that time, there was 13 fire agencies. So we looked at their history, the type of services it provides, how it provides the services, what was their ISO ratings, what was their call data for that year, what were those calls for? We looked at their existing apparatuses and facilities and the conditions of those apparatus and facilities. So it was a very extensive technical analysis of each individual agency. And not much has changed in the last 5 years. They still have the same stations. They still have the same apparatuses. Their boards are pretty much the same. So when we wanted to create this report, we didn't want to just give you the same information. So we wanted to do something different. In the 2026 report that's included in your agenda packet, we kind of took that concept of looking back. So as I mentioned, we looked back at the 2021 report and we wanted to see what we covered. And so we wanted to go further back and see, are there any other historical documents that talked about the existing fire agencies and did they provide any recommendations? We were able to find 3 historical documents from the 70s, the 80s, and the 90s. And what was interesting in those reports, they made some recommendations about efficiencies and even reorganizations or consolidations. But what intrigued staff is that a lot of the recommendations from the 80s and 90s, this commission has recently implemented in recent years. For example, the 80s report talked about Francis 40 Fire and Scotts Valley Fire. They have a lot of similarities. They should merge. And in 2023, this commission approved the reorganization of Branson 40 and Scotts Valley Fire. The 90s report talked about, Central and Aptos, Capitol, they have a lot of similarities. They should eventually merge in some capacity. In 2021, this commission approved that consolidation of Aptos, Selva, and Central. So a lot of recommendations. It took 40 years to reach that conclusion, but that report kind of planted that seed. And so that's where this staff wanted to replicate that kind of concept of looking at the past to have a better understanding of the current status and maybe make recommendations for the future. So that's what this report does. We don't do a deep dive like we did in 2021, but we look at a more high-level approach. We looked at the regions and we look for similarities. And that allowed us to provide some findings and recommendations. So some of the findings were, when it comes to transparency, we noticed that some agencies were more transparent than others. So we made recommendations to be more transparent on their online websites. For more complex examples is we looked at the fact that some of these agencies are doing the best they can with the finances that they have. But as you know, it's very difficult to run a fire district in today's world. It's expensive. And this is not a Santa Cruz County issue. It's not even a state of California issue. It's a nationwide issue. It's just very expensive to operate a fire district. But our agencies are doing the best they can. And so we wanted to identify that by not only just identifying their financial health, but looking at fiscal indicators. So you'll see in this report, there are some fiscal indicators that we use. For example, liquidity. Our past presentation with the healthcare district, they talked about cash on hand. So we looked at that liquidity ratio and we see, do these agencies have enough cash to cover current liabilities? And I'm happy to say the majority, if not all of them, have enough cash to cover current liabilities. So there is financial stability in our fire agencies. Now, that sustainability is still a concern, but again, they're doing their best they can. So that led to some more high-level recommendations. But before I get into those, I did want to mention that this report was shared with the fire agencies because Santa Cruz LAFCO staff is a huge advocate of making sure we're all on the same page. So we might reach a conclusion, but we want to make sure that it's vetted by the fire agency. So we provided a draft copy of the report to the 12 agencies and they provided comments, but we didn't get any written opposition or formal complaint about the report. We did get comments, but no pushback from the fire agencies. And what I've been hearing is we're kind of stating the obvious here. But this is a good starting point. We want to make sure that this report means something. It leads to something. It can be a stepping stone. It can be a vehicle for conversations. But at the end of the day, we wanted to make sure that we had an opportunity to coordinate with the agencies before we publish this report. So this report that's being presented to you has been vetted by the fire agencies. And we also shared it with the grand jury. We also shared it with FDAG, which is the Fire District Advisory Group that the county manages. So again, we are trying to tell a story here, and we want to make sure that everyone has an opportunity to help us complete this report. Now, the big recommendation in this report is about the regions. So again, we looked at the agencies and we tried to group them. So we identified 3 regions in this report. The Valley region, which has 4 agencies. It's Belton, Boulder Creek, and Lowman, and Zayante. What's interesting is they have a lot of similarities. They have a lot of common issues. And when there is an emergency, they always band together and work rather well. We also look at the urban region, which includes Central Fire, Scotts Valley, the city of Santa Cruz, and the city of Watsonville. That's dense with population, and again, a lot of similarities with those fire agencies. And then we have the rural region, which includes the Aromas Tri-County Fire Protection District, which has a small service area in the southern portion of our county. We also have Pajaro Dunes with CSA 4. We have CSA 48, which is a large fire agency in our county. And we also have PB Fire, who is currently exploring reorganization with CSA 48. But again, a lot of similarities in the South County area. So the intent was to identify these regions. And another way of doing so is developing a regional sphere. Similar to what we did with Branson Ford and Scotts Valley back in the 90s, 1995, the commission at that time adopted a combined sphere because they indicated that in the future, whether it's a couple of years from now or later down the road, those two agencies should explore consolidation. And it took about 40 years to reach that conclusion. But what was interesting is that that combined sphere helped us to have those discussions. So this is what we're trying to accomplish here today. We're trying to use these regional spheres, which are just planning tools. So it does not require the agencies to consolidate. There is no recommendations here about we want the agencies to consolidate or reorganize, but it allows us to have that conversation. And this report has already triggered conversations from the agencies of, are these regional spheres the best way to represent the county? Maybe we should have a southern sphere. Or what about Pajaro Dunes? We're not really rural, we're not really urban, but we're currently in so it's already triggering conversations. And that's exactly what staff wants to see in this report. We want it to lead to something, to have conversations. And so I like to use analogies. So this report is a seed. The soil is a status quo. So this report is an opportunity for us to see it grow. And how it will grow is by watering it. Watering it meaning having conversations with the local agencies. And the fact that LAFCO is no longer seen as a threat, but a partner in this county is a win for this commission, because now we can have those conversations and they know that if LAFCO encourages them to look at something, it's because we want them to succeed. We want them to reach the best level of service possible. And so this report allows us to have those conversations. And eventually, it may grow to something. It may be a small little flower where they improve their website, to maybe something more robust when they consider consolidations, maybe 20 years from now. This report can be that vehicle for the short and long term. So with that being said, we did get a comment from local agencies. I mentioned that we did get comments about the fiscal indicators of, maybe that doesn't really tell the whole story of the financial component of the agency. And that is by design. Those fiscal indicators gives you a question of why is that number negative? Okay, well, let's look at their financial performance. Again, it triggers those type of questions. We also got questions from fire agencies about the regions of, well, why is the city of Watsonville in the urban region? Why not have its own South County region? So good questions. And that may trigger the need for special studies. And that's what's being recommended in this report requiring or considering special studies regarding these regions to see if we modify these planning tools. Again, they're planning tools. They're not set in stone. They can be fluid. But the intent here is to have trigger those conversations. We did get 2 comments from members of the public regarding this report. Those 2 were emails, and they were specifically about the proposed Pajaro Valley Fire Protection District reorganization. One email was from a non-resident of PB Fire that, for lack of better terms, accused LAFCO of forcing PB Fire to reorganize with CSA 48. Your staff unequivocally disagrees with that accusation. We did not force PB Fire to initiate annexation. In fact, the PB Fire board adopted a resolution unanimously to initiate this change of organization. So that agency themselves made that determination. And the success that we've seen these last couple of years, like the Branson 40 reorganization, the Central Fire, those entities were the ones that initiated. LAFCO, again, we're watering it. We're encouraging them to explore, and we'll be partners with them, but we're not here to force them to do anything. That top-down approach is not successful. And this commission has realized that. So we are partners. But I will say that this reorganization with PV Fire, LAFCO did require the fire district to conduct community workshops, and your staff participated in those 2 workshops. One of them was on a Saturday at 9 a.m. My wife was not happy with that, but I and your staff are determined to provide as much information and be transparent as possible for those residents, because what is being asked of them is not only a change of what they're accustomed to of having a PV fire protection district, but that also requires a financial impact to them. And so right now in today's world, we're all tight with money. So LAFCO wants to make sure that the residents are fully aware of what is being proposed to them. And we are requiring the district to educate the residents about why they initiated this. So in LAFCO, again, we're not forcing them to move forward this reorganization, but we're here to help them along the way. And we're partnering them with the county, because we can't force the county to take them over. We can't force PV Fire to move forward with this. We can't force the residents to accept this. But in order for this to be successful, we all have to be on the same page. And LAFCO is currently the facilitator of those discussions. The other email that we received was from a resident of the PV Fire District. And they noticed that there's a couple of recommendations about special studies in this report. And they asked, well, you should do a special study on this proposed reorganization. State law does not require a special study or feasibility study for the reorganization involving PV Fire. Again, LAFCO can't force them to do a study. However, if PV Fire or the county under CSA 48 determine that a special study is needed, then LAFCO will help them with that process. But again, we can't force them to have that study. So those are the 2 members of the public correspondence that we received. Again, we did not get any formal opposition or written correspondence from the fire agencies themselves. This is a planning tool. This is a resource. At the end of the day, it's telling a story of what are the agencies doing well, what are the areas of improvement, why is fire protection being provided at this current status, are there any other alternative approaches? And at the forefront, LAFCO can provide that information, and we could be a driver for those discussions. So that being said, staff is recommending that this commission approve the draft resolution or adopt the draft resolution approving this 2026 countywide fire report with the following conditions. 1 is to reaffirm the existing spheres for the 12 fire agencies. So I talked about the regional spheres. Those regional spheres do not replace the individual spheres for the agencies. So PV Fire has its own spheres, Felton has its own sphere. Those stay in place. But we are just adding another planning tool with these regional spheres. So we're requiring we're requesting the commission reaffirm those sphere boundaries, except CSA 4, which is the next condition. Back in 2021, we meaning the commission, adopted a 0 sphere for CSA 4, because right now they were grouped in with CSA 48 with the contract with CAL FIRE. So at that time, staff was like, well, maybe it should be dissolved and merged with someone else. Since then, CSA 4 passed an assessment. They're financially sustainable. They made it clear that they have no interest in being reorganized with the neighboring fire agencies. So staff is recommending that we establish a coterminous sphere for them. In other words, it's the exact same as their jurisdictional boundary. But this shows that staff and this commission see CSA 4 living on in perpetuity. The third condition is that we're requesting that the commission adopt these 3 regional spheres for the valley, the urban, and the rural areas. Again, they're planning tools. We can coordinate with the agencies to see if we need to modify these regional spheres. But again, it's a good vehicle for having further conversations with the agencies. The next condition is to request that the Aromas Tri-County Fire Protection District, CSA 4 and CSA 48, update their websites by the next service review cycle. So again, we looked at each fire agency's website, and some are more transparent than others. It is imperative that information is relatively available for the public, so we're requesting that those 3 agencies provide more information online. We are requesting that the city of Santa Cruz disclose their assets and liabilities like the other fire agencies. In the city of Watsonville, it's relatively available. We weren't able to find that information online. So that's something that we're encouraging. It's not a requirement, but we're encouraging the city to consider that in their future audits. We're also requesting, and I'm almost done, I promise. We're also requesting that the commission direct staff to consider an RFP to hire an outside consultant to help us look into converting CSA 48, which is currently managed by the county, into its own independent fire district. The 2021 report allowed us to have further discussions with the county that led to a special study, and we were working on a transition plan. But this PB fire reorganization came, and we weren't anticipating it coming so soon. So we lost a little bit momentum on that analysis. And now that we have a new county staff members on board, it may be a good opportunity to pass the baton to an outside consultant to finish that analysis. So that's something that staff is encouraging the commission to consider. And if so, we'll bring it to the commission for approval and consideration in October. We're also asking the commission to direct staff to work with the regional agencies, the rural and the urban specifically, to see if there's any special studies. As I mentioned in the report, Central and the city of Santa Cruz were exploring alternative ways of providing services, maybe even looking at consolidation or some type of partnership. That kind of stalled when it was presented to their respective boards. I think this is an opportunity for LAFCO to kind of take the lead in conducting that analysis and providing that data to those agencies, and they can determine whether or not they want to move forward with any governmental changes. Same approach with the Valley. Staff wants to be very mindful of the Valley because of the unique dynamics. So we're not proposing any changes, but we want to make sure that we continue collaborating with the Valley fire agencies and see, is there anything that we can do to help? And that's something that I feel that we've been able to make a lot of progress because LAFCO wants the Valley agencies to succeed. We just have a funny way of showing it, but we want to continue working with those agencies and the public. And lastly, staff is requesting that the commission direct staff to present and provide and distribute the final version of this report to all the affected agencies identified in the report so they can have that in their records. So that concludes staff's presentation. I really appreciate your time. Thank you for your patience, and I'd be happy to answer any questions.
Thank you for that in-depth report and recommendations. I'll now open it up to public comment. Welcome.
Hi, can you remind me what my time limit is?
3 minutes.
3 minutes.
Oh, you want to go first?
Oh, go ahead.
Okay. My name is Ilo Nilsson. I'm a long-term Greater Valley resident. I'm currently in Felton, although I had, my kids went to school in the Felton Fire Protection District when I lived in Ben Lomond. And my son had an incident where that could have been life-threatening, where Felton Fire saved him. So even as a Greater Valley resident, I highly valued Felton Fire because their services affect throughout the valley. I want to thank Mr. Serrano because he has been very available to us, and we are very appreciative of that. I'm a member of Felton Community for Emergency Response, and I appreciate that in your report that the volunteer-dependent staffing models are increasingly unsustainable and that is noted nationwide. And while it's important to the community, the demands and consistent staffing levels, rapid turnout, and specialized training are challenging to maintain through volunteer models only, and that is something that needs to be addressed. And the current assessment in Felton is looking to address that issue and also to have modern fire and EMS operations with specialized equipment, compliant facilities, and regular capital investment to be able to deal with the statewide escalating construction costs, stricter facility standards, and longer apparatus replacement cycles that are putting pressure on our agencies. Felton Fire's funding model has remained unchanged since 1947. All the other districts in the valley have either increased their portion of the property tax pie prior to Prop 13, is it? Or they've added on assessments. Felton is still dealing with the model from 1947. And so we have an assessment out there to address all of this. I do have a couple of other comments, but just quickly before I do, could you please stand if you're in support of the Felton Fire assessment? Thank you so very much. To finish off my comments, we realize that the long-term planning that you're looking at is over 40 years. We need a sustainable fire department in Felton meeting our needs right now. And so to this end, we appreciate any support and acknowledgement and recognition of the efforts that Felton Fire has been doing. We appreciate that in past reports here at LAFCO, it has been highlighted that Felton has been improving in numerous areas, including being the only one in the Valley having all of their board meetings available on Zoom. We realize that CSA 48 is now looking at becoming a special district, so that makes it a bit of an unknown, and look forward to having that find its way to finalization before we consider what options that may provide, because currently it's not a good option at all. And I can go into that later, but my time's going to run out. I did have a question on the presentation, Mr. Serrano. The sphere of influence is expanding. Felton Fires is expanding. Are we picking up part of CSA 48, or what is that edge that we're picking up?
Thank you for your comments. And Chair, I can.
Thank you. If you would.
Yes. So the Felton Fire Protection District sphere has been in place since, I believe, the late 90s. So that has always been in place. So hypothetically, what that sphere is showing that if Felton were to expand or grow, that area that's currently serviced by CSA 48 makes sense to be annexed into Felton. However, that would require initiation by Felton Fire, and the residents that would be annexed need to be in support. So there is a process, but that is a planning tool that LAFCO has indicated that if Felton were to grow, that area would be detached from CSA 48 and currently annexed into Felton. I'll refer to the chair for you.
If you do it quickly.
So good question. So the Felton Fire Protection District sphere, their individual sphere, stays in place. That's not going to go away. In addition to that sphere, we're also looking at larger regional spheres just for planning purposes. So just to identify the similarities, whether it's population, demographics, but that's something that we are just adding in addition to Felton's fire sphere. So no, that we're not proposing any changes to Felton's sphere bound. And Chair, Vice Chair, I also want to note that it's very encouraging to see the progress being made by Felton Fire. As you know, LAFCO wants Felton Fire to succeed. We want to make sure that that community gets the best level of service possible, whether it's through Felton Fire or another entity. We just want to make sure when someone calls 911, they get best level of service. They get a team. That's what we expect, and that's what they're working on. That they're striving for, and we've seen improvements, and we wanted to reflect that in this report. But also, what I wanted to mention is that it's encouraging to see the residents' awareness of the issues and how they are really being proactive on coordinating with the district to support this proposed assessment. So that, again, for LAFCO staff, that's very encouraging. The fact that I've been seeing when I've been driving in the Valley area, stickers of, keeping Felton independent or strong, that's great. I'm like, I want that sticker because I do want Felton Fire to succeed, and you can see the progress being made. And I hope that they continue that momentum.
Agreed. Thank you. Welcome.
Hi, good morning. My name's Don Jarvis. I'm a resident of the Pajaro Valley Fire District. I'm coming to you this morning with one very simple request, and that is that the commission authorize a outside consultant to do a comprehensive analysis of the Pajaro Valley Fire District reorganization. I believe this is appropriate at this time because it harmonizes very well with one of the staff recommendations, that's 4F, which is to direct staff to conduct a request for proposal by October 26 to hire an outside consultant to produce a feasibility study exploring the reorganization of CSA 48 into an independent fire district. So right in your report is a recommendation to do an independent study. What I'm asking is a similar study, harmonizes with this, to look at the Pajaro Valley Fire District. The reason why this is important is because the Pajaro Valley Fire District reorganization is not a simple fire district reorganization. There are very significant financial impacts to our community and to the individual property owners. It was acknowledged at the town hall meeting last week that the cost of reorganizing under CSA 48 is $500,000 a year higher than maintaining an independent Pajaro Valley Fire District. Now, those costs haven't been independently analyzed or justified. That's just a number. The other thing is that this reorganization hinges on the application of the 2 existing CSA 48 benefit assessments to all of the parcels in the Pajaro Valley Fire District. Now, I acknowledge LAFCO has the authority to do this, but having the authority and then exercising the authority in strict accordance with the law, they're 2 different things. So I'm concerned that the way that this is being done potentially deprives us in the Pajaro Valley of our protections under Article 13D of the California Constitution, which is where Proposition 218 lives. So given the complexities of the project, the financial implications, and the potential risks involved with the Prop 218 assessments, I ask respectfully that the commission include, as part of your recommended actions, directions to staff to hire an outside consultant to look at these issues with the Pajaro Valley Fire District. Thank you.
Thank you. Welcome.
Good morning. My name is Becky Steinbrunner. I am a long-time, 41-year resident within the CSA 48. I'd like to ask that this be changed to Santa Cruz County Fire Department. That's what it is. CSA 48 is a funding mechanism, but the actual department is Santa Cruz County Fire. And Santa Cruz County Fire includes the funding mechanisms of CSA 48 and separately CSA 4. A lot of people don't understand what is Santa Cruz County Fire. And in fact, the Santa Cruz County Civil Grand Jury even investigated that. So I have many comments. I want to first correct, I was very tired when I wrote the correspondence to you, wherein I said that in an earlier town hall meeting regarding this at the Pajaro Valley Fire District area, it should read that the people were given no information about what the costs would be if they were to annex with the Santa Cruz County Fire. They were given no information. And in fact, the county has not provided, has been reticent in providing anticipated county fire fees, assessments for Felton and not for Pajaro until the board agreed to dissolve. And that is not right when people are being asked to decide what their future is and how much it's going to cost. CSA 4, the financial figures that are provided, those figures do not reflect the huge increase in assessments that CSA 4 has. They went from a little over $1,000 to over $3,000 per unit. So the financial figures for CSA 4 are not correct, and they are not adequate. What I want to say, first and foremost, is do not approve this report. Do not approve it until your LAFCO ad hoc committee on fire consolidation meets with the boards of these affected fire agencies. You have that committee, and to my understanding, it's only met once for just a few minutes. You also have Santa Cruz County Fire Department Advisory Group, which I have not been able to join the meetings as a member of the public. And I have seen in their correspondence that they're not being really considered with anything other than fluff. So do not approve this report. I want to say that, may I have just one more minute, please?
Oh, we need to keep it to 3-minute comments.
All right. My correspondence does address problems within CSA 48, and I'm a member of CSA 48. There are islands that do need to be addressed. Thank you.
Thank you. Welcome.
Good day, commissioners and LAFCO staff. My name is Corey Schaefer. I'm the Watsonville Fire Chief, appointed January 1st of 26. I am not new to the fire service. I've been employed there for 27 years, so a little bit of experience, but new to this role. So thank you for having me and available for this public input. As department head, the Watsonville Fire Department greatly values the effort that went into this report. It's much appreciated. And the collaboration that you had with my agency is appreciated as well. The report provides foundational knowledge to make educated decisions moving forward based upon data. It is no secret that the fire departments increasingly have struggles with budgetary restraints, recruitment, and response through and across jurisdictional boundaries to best serve the Santa Cruz County communities. Watsonville Fire Department has been dedicated in serving our constituents from our inception in 1861. We additionally are proud to have served the areas of Pajaro Valley Fire District from the 1990s and continue to do so. This is not forgetting the mass mutual aid, the mutual aid agreements within the county, and the auto aid agreements that we are happy to continue. We support LAFCO's recommendation of a study to that of CSA 48, item F, but with a slightly expanded scope looking at service delivery and long-term viability for residents of the South County, which would be actually identified as item G, to increase that study to include item G. We are open and interested in participating in a study that informs how fire services remain effective in the Great Pajaro Valley, in which I provide service, but additionally, of course, to the entire county. I want to once again thank the Commission for this report and express my appreciation for your continued support for the community. And it is very nice to meet with you today. Appreciate it. Thank you.
Thank you. Welcome.
Good morning. My name is Kanda Whaley. I'm a longtime Felton property owner in the district. And first of all, I wanted to let you know that a year ago, I had no idea what LAFCO was. And I can guarantee that Felton knows who LAFCO is right now. And a lot of the San Lorenzo Valley, because, you know, we're a connected communities and we share information, good and bad. And so now when people mention LAFCO, they know who you are. So thank you for your work. Mr. Serrano, I know you've really, you know, tried to answer questions for us and so forth, and that's so appreciated. I went through the report very quickly early this morning, and I just flew in from an international trip a couple days ago, so I'm a little hollow-headed. But I did notice, I know this is gonna maybe sound so petty in the big scheme, but one of the factors in there was transparency. And that word has, I will tell you this, almost 9 months ago or so, there were a couple articles that came out locally with that word transparency and about how our Felton board and the chief were not being transparent. The person who was writing those opinion pieces got ixnayed from being able to write them anymore because they weren't reflective of what was really happening. But that word's still floating around out there because it was put in people's heads. So if there are naysayers for the assessment, that's one of the things that gets thrown out. So I did happen to notice you have a chart on there about the transparency ratings. And we got 90%, which I thought was great. All of the Valley ones got 90%. So but the last one on there said, mentioned something about having LAFCO on our website. And we actually do. In fact, if you go to public documents, you click on there, there's a file folder that you can click on that's titled LAFCO. So I would suggest, especially if you are going to be approving this, I know it's a little thing, but it means a lot of how we can communicate. I'm a career educator. I go for 100%, 90 is fine. But I think we should have gotten checked off on that, especially we've redone the website and it's even easier to find now. So I wanted to point that out. And also one quick thing about volunteerism. I love the statement about how it's not sustainable anymore nationwide. It doesn't quite match up with some of the general, there's a lot of, I don't mean this as an insult, but sort of a kumbaya, you know, we're all doing okay. And there are details in there that would help about what we need to do to change that and get into the future. I think that's a little bit missing from the report. Next time I would love more details. For example, 300 calls in Vianney compared to 900 in Felton is a big difference, those kinds of statistics. But thank you.
Thank you. Further public comment? Seeing none. Anyone online?
There is one. It's a representative from CSA 4 Pajaro Dunes. So I'm going to ask Mr. Charlie to unmute himself.
Thank you.
Thank you. This is Charlie Eady Consultants. I work with the Pajaro Dunes homeowners associations, represent them in various areas of concern, including the fire district and also including county policy, sea level rise, etc. I'd like to support the recommendation that you reestablish the coterminous sphere of influence for CSA 4. There really is no logical reason that CSA 4 should ever be annexed into either Pajaro Valley Fire District or CSA 48. It's a unique area, even though the regional sphere idea categorizes Pajaro Dunes as rural, the service provided there is actually urban in nature. Also, so in addition to supporting that recommendation, there are a few changes that I'd like to see in the report. I went over them with Mr. Serrano yesterday. There are a couple of minor changes to the maps that he said he could correct. And also, I noted also, as did Becky Steinbrenner, that the financial situation with Pajaro Dunes and CSA 4 is leaves a wrong impression because it doesn't capture the current financial situation that has accrued due to the assessment that the residents agreed to impose on themselves. So they wanted a high level of fire service and they're willing to pay for it. And they have a financial situation now that is solid, and there won't need to be any change to the assessment until perhaps 2030 or so, based on our conversations with the county GSA staff. So with that, I again would like to support the sphere of influence being established as a coterminus for CSA 4, and that some of these corrections be made or footnotes be made into the report to clarify the financial health of CSA 4. Thank you.
Thank you, Mr. Charlie.
Thank you. Seeing no further public comments, I will open it up for questions from the commissioners. I'll start on this.
Thank you. Bear with me. I have a few questions. First of all, thank you for this extensive report. I thought it was very helpful, very thorough. I really liked the regional view perspective, and certainly interested in hearing what different fire agencies have to say about that, as you spoke to some other ways of viewing it. But I think it's a nice way to kind of give a different perspective. One of the things I thought of as I was reading the report was maybe in the future looking at the densities and actually having a report of the densities in the different areas. Because as you look at it, you see the acreage, and that can be really misleading when you see one fire station managing a huge amount of area and then a smaller regional area that has 7 fire stations. And I think it'll make more sense when we look at the densities. I really like on page 81 that fiscal analysis. I think that's very helpful. And I look forward to more of that in the future. You talked about water poor areas on page 78, and I'm curious to know a little bit more about that. It was just a brief couple sentences. Where are those? And maybe in the future delve into that a little bit. But if you have any thoughts on that.
This was a way for staff to kind of highlight the private water systems in the county, which we've addressed in a previous countywide water report. But it will help us have those discussions with the water districts that are coming up. So I wanted to plant another seed within the seed of this report about the water concerns in the county.
Great, thank you. I don't necessarily think this is the place or time, because I heard you say you're going to do a report coming up about the CSA 48, the advantages and disadvantages of either remaining CAL FIRE or becoming a private agency. So I'll hold off on that unless you have some very top level thoughts about that.
No further thoughts on that.
Thank you. Regarding aromas, and I'm sorry, this shows my lack of knowledge of that area, but it's called Tri-County, so I'm assuming it's within the 3 counties, San Benito, Monterey, and Santa Cruz. But our LAFCO is overseeing CSA 4?
You mean Aromas Tri-County?
Aromas Tri-County.
Yes, so a small portion of their jurisdictional boundary includes South Santa Cruz County. The vast majority is in Monterey County, and they also, like you mentioned, they also serve a portion of San Benito County. So the principal LAFCO, or the one that has oversight on an agency, when they serve multiple counties, depends on the assessed value. So in this case, Monterey LAFCO is the principal LAFCO, so any changes to their boundaries would go through them. That being said, we're not prohibited from analyzing them in our service reviews, and because they provide services to our county, I did the same analysis that I would for any other county or any other agency in our county, just to tell the full story.
Thank you. And many of you know I serve on Central Fire, and having done lobbying on behalf of the fire agency, I'm keenly aware, and I think our public is keenly aware of not just local, statewide, and national issues that are gravely concerning in terms of the viability, the funding of our fire agencies. We are challenged with private equity, where we're seeing the costs of capital, our fire engines going from 300,000 to $1 million to 3 million, taking 2 to 4 years to get these engines. Property values skyrocketing to build new fire stations as needed. And also really important to understand that we have legislators that, well-meaning, are trying to build housing as quickly as possible, but forget the downstream impacts of some of the legislation that they put in place, which take money from already struggling agencies. So we really need to bring that awareness. And then the volunteerism, where we have this is a place now where the workplace is less focused on volunteerism and fire and more on high tech in our area. And that's really impacted us. So we have increased challenges. And one of the things I wanted to find out is, as LAFCO, can we have a bigger impact on bringing public awareness, bringing this awareness of these really significant challenges, even on the national perspective? There's some things that we learned at our recent state conference that are impactful. So I'd like to see if we can bring more public awareness as an agency. And then finally, I heard a couple of different members of the public here, and I remember in a past LAFCO agenda, we had talked about this difference of what Pajaro is paying versus what is coming out of CSA 48. Is it logical? Would it be a logical addition to consider adding this consultation and this review that was brought up by a couple members of our public? Thank you very much.
Thank you, Chair. And I'll, if my Vice Chair, I'll respond to that last comment. I think there is, it's a valid request. What staff would recommend to this commission is ideally we want to get that request from the affected agencies themselves. So if that analysis is warranted and that we get direction from PV Fire and the county under CSA 48, if they want to see that type of analysis, they come and request that from this commission. I think that's more appropriate because again, perception is everything. So I think it's premature for staff to say, PV Fire, you must do this analysis without having a conversation with them, as well as the county under CSA 48. If we have a dialogue, so if you direct staff to coordinate with those affected agencies, we can come back at our next meeting and determine whether or not that's something that they want to explore and implement. And that's something that I would be comfortable presenting to this commission. So again, it's definitely an option, but I want to make sure that I have those conversations with the affected agencies before I recommend us moving forward with that approach.
Thank you.
Question?
Just in terms of process, I'd like to clarification that in approving this report, we're not, well, let me rephrase that. There's been a couple of suggestions for minor changes and some discussions you've had recently since this was posted to us. Will approving this report prohibit you from making those minor changes? And also, we are talking about further studies that would not be, approving this report would not prohibit the ability for LAFCO to do further studies. Is that correct?
Exactly. So the recommendations as they stand with the conditions, staff still feels comfortable that the commission can move forward with them. These minor edits, for example, what I wrote down is the Felton website. I think that's a administrative change that staff can do as part of this approval. So you don't need a subsequent condition to this. That's something that LAFCO staff can do. The CSA 4 correction that Sir Charlie Eady mentioned about correcting the little issue with the map, again, administrative, that can fall under this recommendation. But the bigger ones about the request for the PV Fire analysis, that's something that we can come back. We don't need to postpone action. We'll just come back as a separate agenda item, as well as you mentioned special studies. So that is vague by design. So this is something where the commission can approve. I can coordinate with the affected agencies and we can determine what type of special study, if a special study is needed. And we'll bring it back to the commission for direction of whether or not you want us to actually do that study. What that study may be is yet to be determined.
Thank you.
I would recommend that the commission consider staff's recommendation. I do see a hand raised by Commissioner Montesino.
Yes, thank you. I'm really supportive of these actions, and like I said, thank you for all those comments and clarification, especially on the potential studies. Because as a city rep, we are very interested in seeing the overall Pajaro Valley, what that looks like in the future, and the report seems like it's going to get us to a better conversation and see what the future looks like. So. Thank you.
Yes, please.
Quick question, since we were on Pajaro Valley, could we, LAFCO, not initiate the study without getting it from them? And I bring this up as CSA 48 is an option if our 218 doesn't pass. And we've made attempts to get the information of what it would cost so we could do an adequate thing. And the lack of getting that has resulted in scare tactics and stuff like that. We relied on the Pajaro Valley numbers. The last 5-year projection that I saw that I've raised questions about shows an excessive amount of carryover. And as we've talked about today, carryover is the way prices are escalating is apt to be spent. But I know we hired CSI, which does engineering studies and stuff for 218s and other stuff. And we hired them, and they reached out to us and asked if County Fire, CSA 48, could join in that for some of the information, which we said, sure, assuming that there was no additional cost on our part. I had a talk with Chief Wilson, and he didn't initiate that, but the county had. And so it just seems if they wanted, from my understanding, they wanted to find out what money they would get from Felton Fire. So they already know what their overlays are. So, I've heard, that they can't just come up with these numbers for anybody and everybody unless they decide they're serious about it. But in this case, it seems they have that information, but they wouldn't share it with us. And so I think that, to the study, if maybe we initiate it, I would love to know that, because what's happening in Felton is happening in CSA or in Pajaro Valley. And it seems to me, at looking at the numbers, the residents deserve this information because they're the ones going to be paying it. And, looking at simple numbers, it looks like they had basically, for round numbers, $2.5 million thing, and they were going for a parcel tax to get another $1 million to get to 3.0 staffing. Well, they're going to get that, and then maybe a little more by just without any vote and going to CSA 48. So I think there's, we should look at that fairly seriously because it makes sense to me. Then just the report is a report, and I can't take a lot of issue with it, but just for clarification for the board and the audience, it talks about volunteer. Volunteer departments aren't volunteer departments anymore. The volunteer department, when I started 50 years ago, everybody came from their home. When the siren went off, there was no pagers. Then we went to pagers, but everybody came from home. And nowadays, every department in the valley has people there in daytime and at nighttime to respond to calls. But yet we're being criticized in Felton through social media, and even some other board members of other fire districts are going against our 218 because they're afraid if we go paid that it's going to have an impact on them going paid. I'm just surprised because, maybe they're going to hate me for this, but when other districts have had their parcel taxes, you never heard a peep from anybody in Felton about it. But now that we're trying to do it, and granted, since our inception, we've had 41 cents per $100 of evaluation. Out of the 4 districts, Boulder Creek is the highest, then Loman is second, and then Felton. And we got along a long time. Could we keep doing the way we're doing and come up with some money to have a fire chief? Yeah, but if you look at the handwriting on the wall, maybe we're leading the forefront of moving toward adequate protection for everybody all the time. I'm getting older, I'm not getting younger. Probably here would agree. And I want a sustainable, valuable person to get there as soon as they can, not when everybody comes from home. And we found out the hard way when we had an interim chief that he went in the 4 months he was there, he went on 8 or 9 calls by himself because no volunteers showed up. And that's unacceptable. And I can tell you that, that's not a statistic that any of the departments are going to put on their front page, but it's what happens when it's volunteers. And so firefighting in the future and what we want, it's not about money. I mean, it takes money to make this happen. But I'll point out, no defense to the supervisors, but I just read where they want to charge parking. You pay to park at the state parks. They're talking about increasing sales tax. And then yet people say, you know, this is outrageous. Well, you've been saving money for years, okay, because we didn't raise the rates. And one of our districts has had two parcel taxes. The one that gets the most has had a parcel tax. And somebody said to me, well, we only asked for $36. Yeah, but you got the most money and it generates almost $200,000 a year for you. So I don't know. I just, no defense, because I've represented the fire districts for 21 years in LAFCO. And it's near and dear to my heart. It's one of the things I take really seriously and try to read all the reports and understand, same as I do on the fire board. But, you know, the LAFCO report that you asked if one of the other board members, and I met with one of the board members and the fire chief in Zayani, probably a year and a half, 2 years ago, and Joe offered to have that report. And, you know, and that it was a good report, but it came out and, you know, what we should do or our options and stuff. And now we get beat up for it because we're doing a 218 tax, you know, because LAFCO said, you know, you should do this. Well, one of the agencies doesn't want to consolidate with us or do anything with us because we're a PERS agency and they don't want to get sucked into something that they never were. And Jim Hart and I, the former sheriff, go way back, and he was saying a few years ago, he said, with all the, you know, PERS liability, he said, I don't know in 5 or 8 years how the sheriff's is going to afford it. So, you know, I really appreciate the report, but I think there's a lot, not that you can put it in there because there has to be transparency about everybody. And people don't tend to air their dirty laundry.
I will just provide comments on your initial question about the validity of the request on a special study for the PB Fire Board. Again, I think it's valid, but I would recommend that this commission allow staff to coordinate with PB Fire in the county and bring it back as a separate line item for our next meeting. And we can discuss whether we do a special study or as an alternative of maybe we can do that type of analysis in-house. Because as part of the application, there needs to be a plan for service docking, which is like a transition plan. That could be an opportunity for us to do that analysis within that report without having to hire an outside consultant. So again, we've been successful in this process for PV Fire because we've been coordinating really well with the county and the PV Fire district. So I want to continue. I want to be consistent with that coordination before the commission considers doing a specific study for them. So a staff's request would be give us time to coordinate with them, and then we'll bring it back at our next meeting, which is in August.
Well, I agree with CSA 40 investigation because as you're talking about special districts and how they're struggling, I'm guessing people would question how one big special district is going to be any better.
Right. And that's the key thing. Is it feasible and does it benefit the residents? So that's the questions we want to be answered in that report.
Thank you.
First, I just want to thank you all for the presentation. Thanks public for all the amazing feedback and the comments from the board. I don't have any more questions. I think all my questions have been answered. So I'm going to move ahead with moving the staff recommendation and also adding to this direction that we direct staff to coordinate with Pajaro Valley County and other affected agencies to determine what kind of study is needed and return with recommendations for LAFCO to consider at the August LAFCO meeting.
First and a second. And before I ask for the motion, will it matter if one of our commissioners stepped out for the moment?
We still have a quorum.
Thank you.
I'll defer to you if you want to wait for Commissioner or move forward.
I will just a roll call.
Thank you, Vice Chair.
Did we get a second?
Yes, we did.
Okay.
Commissioner Faulkner.
Commissioner Jim Anderson,
Aye.
Vice Chair Joe Clark,
Aye.
Commissioner Justin Cummings,
Aye.
Commissioner Fred Keeley, Commissioner Manu Koenig, Alternate Commissioner Lonnie Faulkner,
Aye.
Alternate Commissioner John Hunt.
Aye.
Motion passes.
Item 7, other business. LAFCO update.
So this, well, we're entering the lightning round. So these next items, I'm just going to go fairly quickly. So quick update for LAFCO, which is a statewide organization for anyone that's interested. Staff went to the staff workshop, which was in San Luis Obispo. Your staff, specifically your analyst, was part of a panel that was well received. Another update is, as you recall, we contracted with Placer LAFCO to provide them assistance in the recruitment for a new executive officer. We are now towards the tail end of that process. I'll be in Placer County next week as we interview the finalists for that position. So I'm happy to report that it's been a great progress. I think it's going to be a success story and a model for future LAFCOs to partner up and save money along the way. So those are the two just minor updates that I want to provide the commission about the Placer LAFCO recruitment process. The fact that we continue to be involved in the statewide organization. This is an informational item, so no action is required, but I'm happy to answer any questions.
Thank you for the update. Any public comment?
There's no request at this time.
Thank you. Bring it back to commissioners for any consideration or question. Seeing none, and this requires no action, I will move on to number 8, written correspondence.
Thank you, Vice Chair. We did receive 2 correspondence. One was from LAFCO providing an update about their ongoing efforts. We also got an email from a member of the public, and I'll defer to the member of the public if they want to provide additional information. This is a informational item, no action is required, but I'm happy to answer any.
Thank you. Public comment? Thank you.
Thank you, Becky Steinbrunner. I did send to your commission a message requesting that you examine the impacts of the county's plans to move ahead with what they call the ring interoperability. It stands for Radio Interoperability Next Gen, RING acronym, radio system for our county. This has generated a lot of discussion within the fire districts. I attended a fire district meeting in at Ziente Fire Station that included board members of the Valley, many of the Valley and other fire agencies. This system is very expensive. And what it will do is pit the haves and the have-nots in the fire agencies. CAL FIRE is not going to subscribe to this expensive system. So how is this going to work if CAL FIRE is the provider of many local fire districts, Pajaro, others, if they are not using this expensive program? So it comes to you. It came to Monterey County LAFCO, and that report, as I say in my email, generated a Monterey County Civil Grand Jury report that just came out talking about the problems and the lack of communication. So I hope that you will be mindful of this issue, especially the ad hoc fire consolidation committee, as you move forward in this county with actions to consolidate fire districts, to look at this regional model. This is going to be very expensive. And what the fire agencies are most concerned about, not only the expense, but is it going to work? Los Angeles County adopted this system, and during the LA fires, it did not work. So, or at least not to the level that it was purported to do. That's what I want to bring to your attention with that message, especially since a couple of you commissioners are on the County Board of Supervisors and on fire district boards. Please be mindful of this in the impacts as we move forward with consolidations and reorganizations. Thank you very much.
Thank you. Bring it back. Commissioners for questions or deliberation. Seeing none, no action is required.
Correct.
On to press articles.
No staff report, these are just articles that we thought was of interest to the commission. This is an informational item, so no action is required, but I'm happy to answer any questions.
Great. Any public comment?
No requests at this time.
Thank you. Back to the commission. Again, no action is required, but if it has any questions or discussion. None. We'll move on to number 10, commissioners' business. None. Actions required. Public comment? None. Move on to number 11. Chairman. Thank you all. See you next meeting, August 5th.
See you in August.
I like that.